Because you can see someone walk in the office that you think doesn't need follow-up. They come in, they're, extremely educated. They seem to understand everything you're saying. And yet when you call and follow up with that person, they're like, well, I didn't take my pill twice last week because, I had really bad diarrhea and I needed to be in court. And instead of calling and saying, hey, I'm really struggling with this medication, is there anything I can do to help so that I can continue to work my job and show up for court and manage these symptoms, or whatever it may be?
Right.
That's just like an example, but you don't know who the person is that's going to really need that follow-up and really need to be pushed to take their pills and manage their side effects.
I worry for those patients who may be in a rural area or, doesn't really have that access to the types of physicians and staff to do that follow-up. So what kind of advice would you, give patients like that who may not have like the stellar cancer center and that support?
It's so hard because also some of these patients might not have access to the internet. Some of these patients can't read. That's something that, when I started working where I work in the inner city, one of the questions we always ask is, do you have any trouble reading or writing? And I was always surprised that there were a lot of people that really couldn't read, and so then you have to provide another way to teach. We like to use a teach back method. So I explain it to you and then you explain it back to me as you understand it, right? But these patients in rural areas, it really is difficult if they don't have a navigator or somebody to guide them through that or access to the internet. I guess they could reach out through their physician's office, but oftentimes even the people working in those smaller rural practices don't have the access to someone that can help them with that. So American Cancer Society is a good place to reach out to that may be able to provide you with information on a patient navigator or resources.
That's great. What else? What are some of the possible risk factors for non-adherence?
Mainly financial. So not being able to get the drug at a reasonable cost for the patient. So not being able to afford their meds, point blank. Side effects and a lack of communication and follow-up with the provider are the three main things that I think really affect how patients are taking their medications. So, I'm lucky enough to work somewhere where we have things in place. And I'm not going to say that there aren't people that fall through the cracks and that I don't have patients that are non-compliant, because I do. But we do try as best as possible to, follow up on those patients, make sure they're getting the care they need, make sure they're able to ask questions. So it's tough.
Well, Allison, as we wrap up, you have just been absolutely amazing and fascinating, and totally we'll have to talk to you again. What's some, I guess, some lasting advice for a patient who is about to start their oral chemotherapy and to really stay true to the medical adherence? What's maybe like the top 3 things you would suggest they do?
Definitely ask questions. Ask about how the drug works, how to take the drug, make sure you understand that, how to manage side effects. If you're not sure about something, or if you're not feeling well when you're taking the medication, reach out to your provider. If your provider doesn't listen, find another provider, which is hard for a lot of people. I mean, I find it's hard for a lot of my patients to get a second opinion. I have friends, I mentor a lot of breast patients informally in my personal life, friends of friends, people that have reached out to me, as an oncology nurse and as someone who's gone through this. And a lot of times I'll say, you need to get another opinion. and, oh, no, I trust my doctor. I don't want my doctor to get angry. I mean, I'm always shocked how much I still hear that. So you need to be your own advocate. Your provider works for you to keep you healthy. And you shouldn't be afraid to ask questions. If something doesn't seem right, it probably isn't. Listen to your inner voice and know the goals of your therapy and what you should expect.
Thank you so much, Allison. You've just been amazing.
Oh, thanks.
And so everyone, make sure to check out the resources and clinical trial information at Ancora.ai, where they humanize clinical trials. And make sure to follow us on social media. Not only are we here on YouTube, but we're also on Twitter, Instagram, and Facebook. So, find us, subscribe. And as always, if you have any questions or want to know about something more in particular, and don't worry, we are going to have Allison back on, leave a comment, subscribe to our channel, and then make sure to catch up on previous episodes. So I'm Megan Claire Chase. And remember, the more you know, the more empowered you will be.